In that scenario, um, do they have similar kind of therapeutic or, similar effects? Because I know that in some cases, the neutral versus the acid, they actually have opposite effects.
Right. So many of the targets of CBD and CBDA are the same. They're very similar. And so yeah, if you look at THC versus THCA and compare their pharmacology in the body, very different. And when people take them, they feel very different. CBD versus CBDA is much more similar. And
Mm,
so probably, one of the targets that's going to be most important for people that are using this is the activity of the serotonin receptor. So they both can kind of reduce anxiety and improve mood via that serotonin pathway. There's been a number of animal studies looking at the two, sometimes not in the same study, but two different studies that have used the same model to evaluate CBDA versus CBD. And you'll see that they can do the same thing. They both can reduce seizures. They both can decrease inflammatory pain. They both can decrease nausea and vomiting. There's a lot of overlap there. Mechanistically, it's usually the same targets. The way in which they're achieving these outcomes is the same, but the dosing is often vastly different, with
mm.
CBDA requiring a much lower dose, suggesting it has, well, what we know from the animal studies is that it has both better bioavailability. So take a dose, more of it's getting into the body. And then it also has more potency once it's in the body. If you look at brain levels or blood levels of these compounds that are necessary to achieve their result, you need much less of it. So more gets in and you need much less. Maybe one of the downsides is that CBD seems to last longer in the body. CBDA, you'll excrete more quickly. You might therefore have to take it more often. But a lot of overlap there.
Yeah, and then kind of one of the nuggets that I picked up watching your presentation from last year was you showed some graphs showing that CBDA is actually better absorbed when it's part of a full plant extract. That the
That
case?
is that I mean, there's findings in rodents. We haven't proven that for humans yet, but based on what we're seeing when people say, we're taking these low doses and they're working really well, and then there is a human study that showed CBDA absorption through the gut was extremely high. It didn't test it like it did in the rodent study on its own versus in the context of a whole plant extract. But all the information we have is pointing to what you said, that essentially, if there's a little bit of THC or CBG present with the CBDA, you might absorb it, or at least a rodent might absorb like 15 times more of it with just a little bit of THC or CBG. Now, none of us would have planned that, but I think a lot of us would have said there is a pretty good chance that for one reason or another, taking this thing in the context of the whole plant is going to beat taking the isolated compound. And that's just a lesson we've learned again and again and again. There's going to be exceptions to that lesson, in certain situations, but typically that is the case. And once in a while, we know why that's the case. This is one of those scenarios where we think we know why that's the case.